Welcome back. It's just about 6:30 this morning, and every Tuesday and Thursday we are joined by an infectious disease specialist to bring you the latest developments and research on COVID-19.
That is Dr. Dana Hawkinson, as always, from KU Health. We appreciate you being here, Dr. Hawkinson. We wanted to know the latest number of COVID-19 patients the University of Kansas Health System has this morning. Bring us up to date.
Yeah, so certainly as of last night, we are at 16. I believe we had 7 in the ICU. So our numbers for the past week have really been staying stable and even getting a little bit lower from where they were probably 10 or 14 days ago, which is good. We hope to stay as low as possible, but are always prepared and ready if we have to continue or if we have a surge of new cases and new hospitalizations.
Cautiously optimistic, right, Doctor?
Yes.
Dr. Hawkinson, this week the CDC released their guidance for reopening. They say it's a 3-stage plan. They say not all businesses and institutions should reopen yet, that largely depending on the number of coronavirus cases in the local areas we are all in. So, Doctor, considering that, with the number of cases we're seeing around our area, in your medical opinion, where should be our starting point for reopening? Are we there now? Do we need to scale it back? Can we be more aggressive with that?
Yeah, I think in the community in the city here on either side, you know, we've done very well, and I think it was only this week that we were able to say that we bent the curve, but that's based on the last 6 or 7 weeks of being in lockdown. So certainly we know that the cases around the city are down, which is a great thing. We certainly can open up. We are doing it, and we need to do that cautiously. We need to make sure that all the businesses are taking the right precautions, doing the right things to keep their employees safe and the public and their clients safe as well. So I think, you know, technically we probably aren't there yet with just the number of cases that need to be seen on a downtrend for the past 2 weeks. But overall, I think that opening cautiously at this point in time is probably an okay thing to do, keeping in mind that we need to do the other things individually and as businesses to help reduce the risk of spread of COVID-19.
Doctor, you've been joining us a couple times a week now for almost 2 months, talking regularly about all kinds of things, including symptoms. We've talked a lot about the wide variety of symptoms, who's going to have worse symptoms, why some people do have symptoms and why they don't. There's a new artificial intelligence tool that could predict who will get most ill from a coronavirus infection and who might not. There's a team at New York University working on this. Can you tell us more about this and what that might be?
Yeah, that's good. So for a lot of different diseases, particularly like sepsis, which is just an overall umbrella term for when somebody is extremely sick, or pneumonia, we have had different prediction models, or scores, as they say, prediction scores. And what that does is it takes into account all of the details of who that person is, the demographics such as age, other comorbidities such as heart disease, diabetes, or lung disease, or cancer, just to name a few. But then it also looks at what is going on when the patient arrives to the hospital. So it looks at the vital signs. It also looks at what are the initial labs, things like CRP, and LDH, and those are inflammatory markers. What are your blood cell count likes? So it takes into account all of those things, and then based on past people and lots of data of people who have had the same infection, then is hopefully able to predict who will be more at risk of severe disease and mortality versus who is maybe going to be more likely to survive and recover. And so those prediction models and those prediction scores are around for a lot of different things. Certainly now, as we get more data, and especially from our experience here in the United States, we're able to develop algorithms and artificial intelligence programs to help better predict who those people might be.
That's a small comfort, considering it's been so scary how some people get hit so hard with this and others don't. Doctor, thank you very much.